Squish. Hello, Mr. Fung. My name is Ryan. I'm a nursing student today. I'll be conducting a neuro assessment on you today. Is it okay?
Mm-hmm.
Great. Can I see your wrist? You tell me your name and date of birth.
Zachary Fung, January 8th, 2001.
Great. Do you have any allergies that I should know of before we start?
No.
Okay, great. So like I said, I'll be doing a neuro assessment on you today. It'll require me to do a bunch of tests that I'm going to be asking you to perform. Just do them to perform them to your best ability, okay?
Yeah.
Great. All right. Do you have any questions before we start?
No.
Okay. We'll get started then. All right, so just doing a general assessment on my patient. Patient has a upright posture. He has a calm demeanor about himself. He does not look like he's in any pain, distress, or discomfort. He appears to stay to age, and he has no signs of cyanosis or pallor. Okay. Mr. Fung, so the next thing I'm gonna have you do is I'm gonna ask you a bunch of questions. These are meant to help guide my assessment and let me know if I should be looking for something specific. Okay.
Okay.
So first of all, have you noticed any changes in your movement or ability to perform your normal activities?
No.
All right. Have you ever had a seizure?
No.
Have you ever had a stroke?
No.
All right. Have you ever had a brain injury such as like a concussion or a spinal injury?
No.
No. And then, are you experiencing any numbness or tingling?
No.
Okay. Great. So these next questions I'm going to be asking you are just to help give a better idea of your mental status and your pain status. All right. So just once again, answer them to your best ability. Okay.
Okay.
All right. So first of all, do you know who you are?
Yes, I am Zachary Fung.
Okay. Do you know what today's date is?
11/15/2020.
Okay. Do you know where you're at?
At my home.
Okay. Do you know why you're here?
I'm getting assessment.
All right. Great. All right. So patient's ANO times 4, normal baseline facial expressions, affect, behavior, and mental status. Okay. The next questions I'm going to ask you are just regarding your pain. Okay. So on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever experienced, where would you say you rate your pain right now?
1.
1? Okay. Now, is this pain something that's just come up right now, or is it just what you're probably normally at?
Yeah, pretty much.
Okay, and that's what you're normally at when you're like eating dinner, watching TV, or anything like that?
Yeah.
All right, so you would say there's no changes?
No changes.
All right, great. Patient has no signs of grimacing, no signs of guarding, and there's no inability to concentrate due to pain. Okay. So, Mr. Fung, that's all for my questions. The next thing we're going to be doing is I'm going to be asking you to perform a bunch of different tasks and movements. These are meant to help me assess your cranial nerves, okay?
Okay.
So just perform these to your best ability, okay?
Okay.
Okay, so the first thing I'm going to ask you to do is can you smile? Can you frown? Can you raise your eyebrows? Can you puff out your cheeks? Great. So for this, I was assessing the patient's facial nerves or cranial nerve 7, which was intact, and the patient's facial expressions were smooth and symmetrical. Okay. So Mr. Fung, the next thing I'm going to have you do is, can you read this big first line right here?
Obesity linked to sleep loss. Researchers identify how metabolism regulates sleep.
Great. Okay. So for this, I was assessing the patient's optic nerve or cranial nerve 2, which is intact. Patient still shows no signs of difficulty reading, and his gross optic nerve is intact. Okay. So Mr. Fung, the next thing I'm going to have you do is I'm going to use my pen light to look at your pupils. Okay.
Mm-hmm.
So just look straight ahead from there. Okay. Okay, great. All right, so for this, I was assessing the patient's ocular motor nerve, which is cranial nerve 3. Patient's pupils were round, equal, and reactive to light and accommodation. The next thing we're going to do, Mr. Fung, is just look at the tip of my pen light right here. I want you to follow the movements of my pen light without moving your head. Just follow with your eyes, okay?
Mm-hmm.
Okay, great. So for this, I was assessing the patient's ocular motor, trochlear, and abducens, or cranial nerves 3, 4, and 6, which were all intact. Patient's eye movements were smooth, rhythmic, parallel, and without nystagmus. Okay. So Mr. Fung, the next thing I'm going to have you do is I'm going to actually still use my pen light here. I'm going to go brush the tip of my pen, the soft part, against a certain part of your face. I want you to just identify where I brushed the pen line on, okay?
Okay.
You're going to do this with your eyes closed, okay?
Okay. Forehead. Cheek. Chin. chin, forehead, cheek.
Great. So for this, I was assessing the patient's trigeminal nerve or cranial nerve 5, which is intact, and the patient was able to identify where I touched my pen light on his face. Okay. So Mr. Fung, the next thing we're going to do is I'm going to go behind you. I'm going to whisper a question to you, and I just need you to answer them if you can hear me, okay?
Okay. What year is it? 2020.
All right, great. So I asked the patient what year it is, and he answered correctly, 2020. For this, I was assessing his vestibular cochlear nerve or cranial nerve 8, which is intact. Okay? So for the next part, Mr. Fung, I want you to open your mouth. I'm going to have you say ah, okay?
Okay. Ah.
All right, again.
Ah.
One more time.
Ah.
Great. Okay. So for this, I was assessing the patient's glossopharyngeal nerve and vagus nerve, which is cranial nerve 9 and 10. Patient's uvula and soft palate raised midline. Okay. And the next thing, Mr. Fung, is can you stick your tongue out? Can you point to the left? To the right? Great. Okay. And can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, great. So for this, I was assessing the patient's hypoglossal nerve or cranial nerve 12, which is intact. Okay, so for the next thing, for the last cranial nerve, Mr. Fung, can you just shrug your shoulders? Put it back down. All right, press against, great, and then press the other way. Great. Okay, so for this, I was assessing the patient's skeletal accessory nerve or cranial nerve 11, which was intact as well. Okay, so Mr. Fung, that's all I have to do for your cranial nerves. The next thing I'm going to do is sensation. Okay, so what I'll be doing is I have this popsicle stick that has a sharp end and a dull end. I'm just going to go touch different parts of your arms and your legs. Just I need you to identify if it's a sharp end or the dull end. Okay?
Okay.
Great. I'm going to start with your upper extremities and do the keep your eyes closed on this one. Okay?
Okay. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp.
Okay. I'm going to go to the other side. Okay.
Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull.
Okay. And and now I'm going to go down to your lower extremities. If you can just move your arms real quick. Just kind of roll up your pant legs real quick. Yep. Great. Okay. And once again, just tell me sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay. I'm going to go to the other side.
Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Okay. Great. Patient has full sensation of his upper and lower extremities. All right. Mr. Fung, the next thing I'm going to do is have your eyes closed. And I'm going to go put things, and you hold your hand. Perfect. I'm going to be putting certain objects in there. I want you to feel around, make sure you know what it is, and can you identify them, okay?
Okay.
Great. So this is the first object.
Chapstick.
Okay. Great. I'm going to take it out of your hand. And then in your other hand, this is another item.
Coin.
Okay. Great. All right. So patient is able to identify objects through stereognosis. Okay. So next thing I'm going to have you do, Mr. Fung, is I'm going to use this little pen right here. I'm going to go draw a letter or a number on your hand. Or I'm going to orient it towards you. So I want you to identify see if you can identify that letter or number.
Okay.
Okay. So.
R.
Okay. And then here's the other one.
3.
Great. All right. So patient is able to identify both numbers and letters through graphesthesia. Okay. So the next thing I'm gonna have you do is hold your fingers out. And once again, this is gonna be with your eyes closed.
Okay.
I want you to identify if I'm pushing your finger up or down. Okay.
Okay.
Yeah. This is up, and this is down.
Okay. Up. Up. Down. Down. Up.
Okay. Other side.
Down. Up. Up. Down. Down.
Okay. I'm gonna be doing the same thing for your toes. Okay.
Okay.
This is up. This is down.
Up. Up. Down. Down. Down.
Okay. Other side.
Up. Down. Up. Down. Down.
Great. Okay, so patient is able to identify directions up and down through kinesthetic sensation. Okay, so the next thing I'm going to have you do, Mr. Fung, is I'm going to ask you to stand up. Right? And I want you to push your arms up like this. You're going to close your eyes too. All right. Okay, you're good. Put them down for now. All right, so patient has no signs of muscle weakness. His muscle extremities are he has full muscle strength with no unilateral weakness. Okay. So next thing, Mr. Fung, is we're going to be testing your gross motor coordination and your cerebral you test your cerebral function as well. Okay.
Yeah.
So for this, I'm going to have you you just watch me for now. I'm going to have you stick your arms out. I want you to alternate touching your finger of your right hand to your nose, then to your left, and just alternating that for a little bit. Okay.
Yeah.
And please do this with your eyes closed.
Yeah.
Okay. And you start. Great. All right, you're good for now. Patient has adequate cerebellar function and gross motor coordination as well. All right. And then for your to test for your fine motor coordination, can you touch your finger to your thumb and alternate between each of your fingers for both hands? Perfect. And you do as quickly as you can. Okay. Great. Patient has adequate fine motor coordination as well. Okay. So for the next thing, Mr. Fung, that we're going to do is I'm going to be doing some deep tendon reflexes. So if you want, you sit down for this one. Okay. Let's go. I'm going to use this one. Okay. So what I'm going to do is the first thing I'm going to do is your bicep tendon reflex. Okay.
Mm-hmm.
So you can just relax your arm real quick. Okay. Just relax it. Okay. Great. Okay. And then over here, once again, relax your arm just a little bit. Okay. Great. And then next thing I'm going to do is your patellar. Okay. So just relax a little bit. Okay. And then once again, relax just a little bit. Okay. Great. So patient's bicep tendon reflex is 2+ equal and bilateral, and the patient's patellar tendon reflex is 2+ equal and bilateral as well. Okay, so the last thing we're going to do for you today, Mr. Fung, is I'm going to be looking at your balance. Okay, so if you can stand back up, and I need you to close your eyes with your hands at your side. Okay. Okay, you're good. So for this, I was a Romberg's test. Patient has a negative Romberg's test, no signs of swaying or sticking a foot out for extra balance or anything like that. All right. So Mr. Fung, the last thing I'm going to have you do is a heel to toe walk. Okay. So all it is put one foot in front of the other, heel to toe. Okay. All right. Great. You're good. All right. Patient has no signs of loss of balance when doing a heel to toe walk. Yeah. So, Mr. Fung, that is all I have to do for you today. Do you have any questions before I head on out today?
Nope.
All right, you have a great rest of the day then. Okay? Squish.